Hi everyone, this is Dr. Hua Cao. Today we're going to continue our Chinese medicine dermatology talk. Today's topic is psoriasis. Now let's go to the slide. Psoriasis is one of the most common and the most important of the inflammatory dermatosis. I've seen psoriasis at my clinic for many cases. The Chinese medicine treatment for psoriasis is really good, I would say. I love to treat psoriasis, honestly, because you see the result. Okay, now let's continue. The first part, I'll talk some general knowledge about psoriasis, like I've just read some, and now let's continue. Up to 3% of the population of Western countries develop psoriasis during their lifetime. The etiology of psoriasis is unknown in Western medicine, especially about what causes some area of the skin to turn into plaques, while others remain normal. There is a strong genetic component. A family history is common, but there is often no clear-cut inheritance pattern. It is also known that some well-recognized triggers may induce it. For example, trauma and infection. Stress can induce or exacerbate the condition too. Now, I show you some of the photos of my patient. This is a female patient, about 50 years old. And these are the conditions of her psoriasis in the first week when she came to see me. You see here's the lower leg. Here's one side of the lateral side of the arm. This is another upper arm at the back of the arm. The rash look red with, if you enlarge it, there's a lot of flakes and dry, and the shape, the skin lesion shape is various. You can see all kinds of shapes. And then I gave her the Chinese medicine treat, and then 6 weeks later, the lower legs become like this, and both elbow at the back, you can't see much red skin rashes, but still some dryness and skin flakes left. Now, let's look at the 9th week. The 9th week, the lower leg, although there's not so much difference between the 6 weeks to 9 weeks in color, but when you look at closely, actually, at the 9 weeks, the skin are more moist. That's at the back of the elbow as well. So that's why I love to treat psoriasis. Most of my patients can achieve good results. There's only one, as I remember, during the 20 years of practice, there was one over 60 years old man who had psoriasis more than 30 years. The treatment result was not as good as I thought, but he said he continuously took herbs with me for more than 1.5 years. I asked him why, because the skin change is not so obvious, but he said it didn't get worse. There were a lot of occasions it might get worse, but because I was taking herbs, it didn't get worse. It sometimes improve, sometimes do not improve. He lives at the countryside, so come to see me normally once a month, once 6 weeks. Sometimes it's a bit hard to monitor. Okay, now these are some website photos of psoriasis skin. I've seen this one, like this abdomen, it's really red in a young, early 20s years old girl. I've seen something similar to this. I haven't seen this one. I've seen something like this. And that's the common area for psoriasis. Maybe this is not that correct, but we leave this picture. We don't talk about this. We just focus on the skin lesions. Now, let's go back to the general knowledge of the psoriasis. The pathological process of psoriasis is a combination of epidermal hyperproliferation and accumulation of inflammatory cells. The epidermal transit time is markedly reduced from the normal 8 to 10 weeks to a few days. There are different clinical patterns of psoriasis. Classical plaque, scalp psoriasis, nail psoriasis, gutted, flexual, brittle, and so on. There are two types of Western medicine treatment, topical and systematic. Each modality is useful in some patients, all represent a compromise in terms of safety, effectiveness, and convenience. Many patients require a regimen of different agents for different sites at different times. Now let's focus on what we're going to talk about today, which is the psoriasis in Chinese medicine. Chinese medicine for psoriasis has few names, different names as well. One is called the Niu Pi Xuan, another type is called the Bai Bi. I think it's mainly follow the appearance of the psoriasis. Niu Pi Xue means cow skin lesion. Bai Bi means white skin lesion. It's represent the appearance of the psoriasis. In Chinese medicine, the etiology and the pathogenesis is the blood heat and the excessive wind is the cause of psoriasis. And what produce blood heat and excessive wind? Now, emotional factors is one of the main, I won't say the only, but it's one of the very major factors which cause psoriasis. In my patient, actually more than half of them have a very stressful life event. They move from another country to Australia to a new country. At the same time, the wife got pregnant and they need to find a job with financial crisis. And all of this happen together or few other things. So, and all of this stress, life events affect the heart and the liver, produce the fire. The fire stays in blood level and cause the red skin lesion. Also produce blood heat. Blood heat produce wind and cause itchiness. Strong wind cause dryness and produce plaques of the skin. The next kind of cause for psoriasis is blood deficiency and wind dryness. And what can produce this blood deficiency and wind dryness? Long-term illness. Long-term illness cause blood deficiency, empty meridians, and then produce light color skin lesion. Blood deficiency produce wind and cause dryness and produce itchiness and plaques. So that's another pathogenesis for psoriasis. Now let's go to the third type. Wind linger in the channels. The above two conditions, A and B conditions, bind exterior wind. The wind is not dispelled for a long time, changes to heat and travels in channels, cause skin psoriasis. So that's the pathogenesis and the etiological explanation for psoriasis in Chinese medicine. We can see actually it's not that complicated. Sometimes when I think about psoriasis, it's simpler than acne, simpler than eczema, and the treatment result is very good as well. Okay, now let's look at how we diagnose. The clinical character of psoriasis is lesions tend to develop on the lateral aspect of the extremities, particularly on the elbows and knees, the trunk and the scalp, most commonly appearing on Sanjiao and the Yangming channels at their locations. Skin lesions can be local or general. Lesions can be all kinds of shapes. If the scalp is affected, lesions are dark red and covered with gray whitish scales. However, hair does not usually fall out, and commonly the fingernails can be affected. Psoriasis is difficult disease to treat and needs many weeks of treatment. That's why we tell patients, be patient first. We will achieve a result. Okay, now let's talk about patterns, different patterns and the treatment. Okay, the first type of psoriasis is blood heat with excessive wind. This is probably most common thing as well. The symptom appears as acute onset, red flat papules at the initial stage, merged into large red flat papules later, rough surface with thin layer of dry plaque, deeper skin lines, some with scratch marks, strong itchiness, irritating dry mouth, bad sleep. Bad sleep often relate to the heat affect the heart, and itchiness. Red tongue, thin yellow coating, weary and slippery paws, or slippery and fast paws. The treatment principle is cool the blood, clean the heat, dispel the wind, and stop itching. The prescription is 凉血地黄汤. You can see here 生地黄. Also the simple version is 生地. It's in a pretty high dosage. And the rest herbs are all focused on cool the blood, clean the heat, dispel the wind, stop the itchiness. Now let's look at the modification. For bad temper, restless, we use 知母, 生石膏, 栀子. Sometimes psoriasis patients have a bad temper, short temper. That's personality, but so far there's no study found that psoriasis patients all have a short temper or bad personality, so we won't say that. Okay, sleepless will add 合欢花夜交藤, and there are a lot of other sleep helping Chinese herbs you can use according to your favor and your experience. Okay, next type is blood deficiency and wind dryness. This kind of patient has long history, long time, or recurrent skin lesion without much color, or light brown or gray color. The skin becomes thicker, rough, and covered with plaque. Strong itchiness, especially at the night, normal or pale tongue, thin white coating, thin or deep and thin pulse. The treatment principle is nourish the blood, moisten the dryness, dispel the wind, and stop the itchiness. Think, what are you going to use for this purpose? Now let's look at next one. The prescription is modified 四物汤. And here again, 生地 is in a very high dosage. So you can remember this. Treating psoriasis, we use strong 生地. 生地黄. Okay, modification. If the skin lesion stays for a long time, we can use 丝瓜络地龙皂角. 丝瓜络地龙 mainly is unblocking the meridians. 皂角 mainly used for soften the skin, say thick skins or stagnated. How to say? It's hard to describe. Sorry, just the skin. We've seen the photos before. 皂角 can soften the hardness. Okay, for night itchiness, we can add 鸡血藤、夜交藤和黄花. Now, the third type of psoriasis is blood stasis. The patient has chronic and recurrent history. The skin lesion look dark or hyperpigmented, covered by thick, hard, and adherent scales. Purple tongue, choppy and thin and slow pulse. Our treatment principle is invigorate blood and scatter stasis. We use 活血散瘀汤. 活血 means invigorate blood. 散瘀 means scatter stasis decoction. And here we use quite a few blood invigorating herbs and moving herbs. Now, external treatment for early stage or erythematous macular lesions, we use 黄柏, 黄芩, plus petroleum jelly for patient. Only one patient accept to use this yellow petroleum jellies. Petroleum jelly combined with some few herbs can achieve pretty good results for psoriasis. For chronic and recurrent lesion, we use 路路通 wash. 路路通 wash we have mentioned at eczema external treatment. Now the ingredients and the prepare details are here. We can try that. For acupuncture, I leave it for yourself to study. Mainly focus on stop itchiness, improve sleep, eliminate blood heat. Now about prevention, as we mentioned before, emotion factors and food factors probably is very much related to psoriasis. So for food, we avoid heat-producing food like spicy or greasy food, sweet food, warm-natured meat, seafood, alcohol, and coffee. Avoid stress. You probably help patient to learn some stress management skills or help the patient to find psychological service in Australia, if you see your family doctor, the family doctor can prescribe you some plan, which Australia government can cover something like 6 or 12 sessions of psychological treatment, which will be done by psychologists, high qualified psychologists, or social worker, or people with a strong counseling background. It helps. So if you want to achieve good result for psoriasis, you can combine all of these services. Now, psoriasis talk is finished. We'll stop here for today. I hope you have learned something. I'll see you next time. Thank you for